Hello everyone. This is one video out of a series of videos that talks about various kinds of birth control methods. It's important to realize that this is basic information. It's really important when you decide that you want to go on birth control that you get an appointment with your healthcare provider. You talk about your medical history because sometimes there are things that are contraindicated in using various kinds of birth control, and that you have that more in-depth conversation about what is going to be best for you. So just realize that this is just basic information about various kinds of birth control, and this is just one of them of a series. I hope you enjoy them, and again, if you have any questions at the end, don't hesitate to email me. Thank you. Hello everyone, Lori from Women's Health on the Go. This video is about the Depo Provera. Depo Provera is an injectable form of birth control. It is something, if you decided to use it, you'd have to go back to your medical provider's office every 3 months. Typically it's every 12 weeks, 12 to 13 weeks, because if you just think about some months have, different amount of weeks in them. So I always tell people that it's typically around every 12 weeks, and you do have to feel comfortable getting an injection. It is only progesterone. So there's a couple of things that are really important to know if you're going to use this form of birth control. One, because there is no estrogen in it, estrogen is what helps keeps our bones nice and strong, okay? And as we get older, when we go through menopause and we have that lack of estrogen, there's that risk of developing what we call osteoporosis. Osteoporosis is thinning of the bone, which makes it more likely that you can actually break a bone. Okay, so if you're doing the progesterone, only birth control, such as the Depo Provera, it's very important that you take some kind of calcium supplement because you're not going to have that estrogen. So that's one thing that you need to know that you're going to have to do. Another thing is that what's going to happen with your bleeding pattern? I don't know. Most people don't have a period at all, but there are people who spot all the time, bleed all the time, or they still get their period. So I always warn everybody that typically most people will end up not having any period or any bleeding at all, but there is a risk of having that irregular bleeding, especially in the beginning when you get your first injection. Your body doesn't really kind of know what's going on, so sometimes it reacts by having a lot of irregular bleeding. Weight gain. A lot of people who use the Depo Provera gain anywhere from 5 to 10 pounds. So if that's a huge concern for you, it's something that you might not want to do. And the last thing, which I think is really important, is if, let's say, you're on the Depo Provera and you decide that you want to start having children, it can take a year to a year and a half to get your fertility back after stopping the Depo Provera. So that's something really important to considering if when you're picking your form of birth control is, hey, I know I'm not going to want to have kids for the next 5 years and you're okay, or I need something for the next year or two before I want to start having children, maybe Depo Provera is not the best choice for you in that regard. So that's basically a very short little, video just about the Depo Provera to hopefully help you, get some information about it and help you make an informed decision about which birth control is right for you. I look out on my channel for my other videos. I have videos on the IUD, the patch, the ring, the pills to help you make that decision. I hope this video was informative for you. If you have any questions, please do not hesitate to reach out and email me. I'll be more than happy to answer your questions. And remember, women's health matters. Thank you and have a great day.